Now, before I go to the metabolism of ethanol, let me give you a brief idea about the types of alcoholic liver disease. Actually, it's not a single type of disease that alcohol causes, it's a wide clinical spectrum. It ranges from mild upset in liver enzymes, which even the patient is not aware of, to advanced level of liver cirrhosis. Broadly, alcoholic liver disease is divided into three types, or you can say stages. Number one, alcoholic fatty liver disease or alcoholic steatosis. Number two, alcoholic hepatitis. And number three, alcoholic cirrhosis. After ingestion, the alcohol is metabolized exclusively in liver within hepatocytes. Now, how exactly the alcohol causes liver injury? We need to look into alcohol metabolism. This is outline of a liver cell or hepatocyte. The whole metabolism seems quite complicated, but don't worry. I'm going to explain you in a very simplified way. Inside hepatocytes, there are three enzyme systems which are involved in ethanol metabolism. These are present in different locations within a cell and are named accordingly. The first very active enzyme is cytosolic alcohol dehydrogenase system or ADH. It converts ethanol to acetaldehyde and uses NAD as an oxidizing agent. This ADH has different isozymes ADH 1, 2 and 3 which have different elimination rates, and as I told you before, that is why different people have different rates of alcohol metabolism and subsequent liver injury. The second one is microsomal ethanol oxidizing system, which again converts ethanol to acetaldehyde but with a different enzyme known as CYP2E1, and during this reaction NADPH is converted to NADP. The third one is peroxisomal catalase, which performs the same function, means conversion of ethanol to acetaldehyde. The product acetaldehyde is converted into acetate with the help of enzyme acetaldehyde dehydrogenase. And again in this reaction NAD is converted to NADH. Now let me tell you that how these chemical reactions are deadly for liver. First, we saw that oxidation of alcohol required conversion of NAD to NADH, right? The reduction of NAD and production of more reduced form means NADH leads to significant changes in redox potential of cell and provides more substrate for fatty acid synthesis. So fat starts to accumulate in hepatocytes. This is called fatty liver or hepatic steatosis, and this starts after days of alcohol consumption. However, the good news is that in case of abstinence, the redox potential of cell is restored, the accumulated lipids start metabolizing and steatosis starts resolving. Second, as a result of ethanol metabolism, free radicals, superoxides and hydroperoxides are formed, and these are called reactive oxygen species, and they cause oxidative injury to hepatocytes. Now, as you saw that as a first step of ethanol metabolism, acetaldehyde is produced. It is the chief mediator of alcoholic liver injury. It is harmful to hepatocytes in two ways. Number one, it damages the cell membranes by altering the activity of membrane-bound enzymes and transport proteins. And number two, it binds covalently with several hepatic macromolecules called acetaldehyde adducts, which trigger immune response and cause local inflammation. Now, let's have a look into the mechanism of hepatic cirrhosis. Chronic alcohol intake leads to increased gut permeability, which increases the level of endotoxins in the blood, which in turn leads to activation of Kupffer cells, which are phagocytic cells lining the sinusoids of liver. As a reaction, they produce various inflammatory reactants, chemokines, cytokines, TNF-alpha, interleukin 8 and 6. This leads to activation of stellate cells, which produce collagen, leading to hepatic scarring and cirrhosis. As I told you that alcoholic liver injury is manifested in various ways. Now let us look into their clinical features one by one. The first one is alcoholic steatosis or alcoholic fatty liver. In this, the healthy liver is replaced by enlarged fatty liver. Its presentation can be just only by elevation of liver enzymes during routine examination while patient is totally asymptomatic. But if the fatty infiltration is severe, patients can have symptoms like malaise, anorexia, nausea, or abdominal discomfort, which is mainly due to enlarged fatty liver. If we look into hepatic enzymes, bilirubin, ALT, AST will be elevated, especially AST levels would be higher than ALT. The good thing about alcoholic steatosis is that it is completely reversible after about 3 months of abstinence from alcohol. The second one is alcoholic hepatitis. In alcoholic hepatitis, there is inflammatory liver injury due to long-term intake of alcohol. The liver is injured to an extent that patient shows features of inflammation like jaundice, fever, nausea, vomiting, and abdominal pain. At this point, some patients may demonstrate signs and symptoms of portal hypertension such as upper gastrointestinal hemorrhage due to esophageal varices, confusion and lethargy from hepatic encephalopathy, or increased abdominal girth from ascites. Unfortunately, alcoholic hepatitis has a worse prognosis and such patients need to be properly taken care of. Biochemistry in alcoholic hepatitis will show leukocytosis, raised bilirubin levels, raised aminotransferases. The ratio of AST to ALT is greater than 1. Alkaline phosphatase is mildly elevated and a specific marker named GGTP or gamma glutamyl transpeptidase is elevated markedly in alcohol abuse. In addition to above symptoms, we will see some abnormality of liver functions which can be in the form of hypoalbuminemia, which is because now the ability of liver to synthesize albumin is compromised. Because of same reason, liver is unable to synthesize some important clotting factors and leads to abnormal prothrombin time. Now from this inflammation, the liver progresses towards a process of scarring called cirrhosis, especially if the patient continues to drink. The term cirrhosis refers to replacement of normal liver architecture with structurally abnormal nodules. These changes in hepatic architecture lead to increased resistance in hepatic sinusoidal blood flow, which results in building up more pressure in portal vein, which could come up as serious consequences like ascites, variceal hemorrhages, and hepatic encephalopathy.